Today I'm going to show you how I do one of my IVF injections. This one is estradiol and it helps prepare me for embryo transfer. First I grab everything I need: an ice pack, 2 alcohol swabs, an 18 gauge needle, 21 gauge needle and syringe, band-aids, and of course the estradiol. This injection goes in my patootie, so I'm just putting the ice pack in my pants to numb the area up while I prep everything. Then I grab my estradiol vial and an alcohol swab and I just clean the top of it. I unwrap my 21 gauge needle and syringe, and then I take the needle off of the syringe and replace it with the 18 gauge needle. This is because it's a lot easier to draw up with a bigger gauge needle. Then I draw up 1 milliliter of air into the syringe. When I inject this air into the vial, it creates a vacuum seal, which makes the estradiol a lot easier to draw up. This medicine is suspended in oil, so it takes a little bit of time to draw up because it's so thick. Then I just tap it to get any air bubbles out and push any air back into the vial. I then very carefully recap the 18 gauge needle and replace it with the 21 gauge needle. This is the needle that I will actually be using to inject it with. Once I have that needle on the syringe, I just take my band-aid and open it up and stick one side to my hand so it's ready for when I need it. Then I take the ice pack out and grab a new alcohol swab and cleanse the injection area thoroughly. After I prime my needle, I count to 3 and inject myself. This needle is pretty long because the injection goes straight into the muscle. Again, this medicine is super thick, so it does take a while for me to inject everything in. Honestly, the hardest part of this injection is twisting around and getting my arms and hands situated so that I can inject from behind. But once it's all in, I just take the needle out and I have my band-aid ready to put on. My appointment to check my lining is next week, so fingers crossed I am responding well to this medication.